And I think you touched on a little bit about concierge medicine. Where do you see the role of concierge medicine, direct patient care going in the future? Do you think I don't think there's ever going to be a time where majority of people are concierge versus taking Medicare and insurance because of just the population, unless like the whole American healthcare system changes, then that's maybe it will happen. But we don't foresee that happening in our lifetime. So where do you see the role of concierge medicine going? Because I see a lot of doctors that are just fed up with the insurances. They're like, man, I'm tired of the insurance telling me how to practice. I'm just going to open my own practice and practice how I was taught in medical school.
Yeah. I think Medicare is not doing physicians a favor by decreasing reimbursements despite inflation. It's just so backwards. And of course, there's talks about with the incoming administration to do an overhaul of Medicare reimbursement and physician reimbursement. I'll believe it when I see it. Uh, Concierge medicine. How do I want to say? I'm all for direct primary care, direct care in general, and concierge medicine. I think it's a solution for the physician and the individual patient. It's not a solution for the system, right? Because as a concierge physician, a direct primary care physician, you inherently need to take your patient panel needs to be less, right? Because now you need to be like more in control of who you're seeing, how often you're seeing them. Um, and so, we already have a shortage of primary care physicians. So by decreasing patient panels, you know, where these other patients go, they go to whatever primary care provider that's not doing that. And it takes 3 months to get in to see them. Uh, so, I mean, there will be ripple effects, but for the individual physician who wants their autonomy, which is at the end of the day, what physicians want, this autonomy and to be paid for their expertise, these are great models, right? You tap into a population who can afford the fees. Direct primary care, maybe it's for people with high deductible plans or patients without insurance. Like, I'm fine, I'm healthy, I'll pay $150 a month just to get into you. And I think it's a sustainable model for sure. And I think we will definitely see more physicians graduate from residency and try to go into these types of practices.